I want to thank everyone for all of this, all the hard work that went into getting this bill to the floor today. I rise today to express my appreciation to all of my colleagues who are considering HRES 353, which I introduced, expressing the need for enhanced support for advanced imaging technologies for prostate cancer detection and treatment. This legislation will lead to the development of prostate cancer screening technologies that are on par with mammography, while improving blood tests and providing education to the general public. Mr. Speaker, the tragedy of prostate cancer has touched so many Americans, and I ask that you consider these issues. Prostate cancer is the second most common cancer in the United States and the second leading cause of cancer-related deaths in men. This cancer strikes 1 in every 6 men, making it even more prevalent than breast cancer, which strikes 1 in every 7 women. In 2007, more than 218,000 men were diagnosed with prostate cancer, and more than 27,000 men died from this disease. One new case occurs every 2.5 minutes, and a man dies from prostate cancer in this country every 19 minutes. To compact the matter even further, African American men are 56% more likely to develop prostate cancer compared with Caucasian men, and nearly 2.5 times as likely to die from the disease. Many of us in the Congress, and indeed throughout the country, have either personally been affected by the disease or had a loved one suffer from it. For me, it was my father. Tragically, our commitment to fighting the disease has not met its impact. To date, the Department of Health and Human Services has failed to invest substantial resources in promising advanced imaging technologies for prostate cancer research. And while they have failed, people have died. As a result of that, there are currently no reliable, accurate diagnostic tools for detection and treatment of prostate cancer. The implications of this reality have been grave. More than 1 million men have unnecessary prostate biopsies each year, resulting in needless suffering and an enormous waste of resources. At least 10% of men undergoing surgery and 44% of men undergoing radiation treatment would have benefited more from watchful waiting. Current treatment is costly and causes many complications, including impotence and incontinence in up to 50% of men. I might note here that Johns Hopkins Hospital and University, which are located in my district, have done many pioneering things with regard to this disease. As a matter of fact, they have some of the leading experts on it. More than 70,000, or about 1 in 2 men, experience treatment failure each year. Mr. Speaker, in this country, with the greatest medical system in the world, we can simply do better, and we must do better. That is why I am so glad that I was joined by 101 of my colleagues in sponsoring HRES 353. This legislation is a first step in recognizing the critical need to address this very tragic disease. I urge my colleagues to similarly take up the Prostate Research Imaging and Men's Education Act, or PRIME Act, H.R. 3563, which I have also introduced. The bill provides $100 million per year for 5 years to expand research on prostate cancer, and provides the resources to develop innovative, advanced imaging technologies for prostate cancer detection, diagnosis, and treatment. The bill also allocates $10 million a year for 5 years for a national campaign to increase awareness about the need for prostate cancer screening and the development of better screening techniques. Finally, it will spend $20 million a year for 5 years to improve current, often unreliable blood tests. Just the other day, Mr. Speaker, as I stood in the bank, I ran into 4 men, all of whom have recently gone through prostate cancer procedures. And it is so sad when you hear them tell their various stories about how it has affected their lives. And I do believe that this Congress can do better. I believe that this nation can do better. So many men have said that, they want to be treated, but they are simply afraid. They're afraid of the pain. They're afraid of the embarrassment. And I spend a lot of time in my district preaching almost to men to make sure that they get the test. But I want them to not have to, if they don't have to have the test and can have a better method of discovering this disease, I want them to have that. And so someone once said that in our time and in our space we can make a difference. And we can make a difference. And I realize that a resolution is one thing, something allocating money to do something is another. And that's why this is more or less a precursor, hopefully, for a legislation which will bring about the resources so that we can properly address this issue. And with that, Mr. Speaker, I yield back.